Good evening, everyone. Most of you have asked me to advise you or give you an idea how you should be preparing for the communication skills stations. As you all know, the communication skills station is divided broadly into two parts. One is the preparatory bay, in which you are given 9 minutes and a stem, and you are given patient's notes or the patient's journal, in which in 9 minutes you have to prepare the notes. And after 9 minutes, bell goes and you go into the next room where you meet your examiner or your fellow colleague or patient's relatives, or even a patient, like in case of inguinal hernia where you have to console the patient in order to stop the warfarin before the inguinal hernia repair surgery. So most of you have asked me how you can utilize those 9 minutes in your preparatory bay the best way. So here are my few tips, or you can say key steps to follow in the preparatory bay. Let me begin. Right. First of all, I'm going to prioritize the key sections, right? Number one, what I mean by that you focus as soon as you enter the preparatory bay, you get hold of the patient's notes or the patient's journal, focus on the most critical part of the patient's journal, like go through the presenting complaint, or the patient's history. You must have already read outside the bay what you have to do inside, what the stem is about. So then you can read about the patient's examination findings. You can read about any recent investigations or treatments which has been done. Once you'll do this, it will give you a quick overview of the patient's condition. Then I would suggest that you move on and use a systematic approach. Then quickly skim through the journal in a structured manner. Start with the patient's demographics, where exactly patient is located, what is patient's situation, then move on to the patient's presenting complaint, move on to the patient's past medical history, any medications patient is using, if or not patient is allergic to any medications, and what social status patient has. This will add up to the relevant information that you've already gathered in your step one. Number three, I would suggest you highlight any important information that you come across. Or after highlighting it, this will make you easier. This will make the whole process easier for you to refer back. And whenever you have to meet your consultant or meet with the patient's relatives or even with the patient in the next examination station, in order to brief all that information over. Number four, I would say that you summarize the whole thing, in whole case, in your own words. So whatever you've understood so far, you can mentally organize it and summarize the information in your own words. This will help you retain the information more better, and it will even become more easier to communicate with the consultant, with the patient's relatives, or with the patient itself in the next page. Number five, I would suggest practice active reading. Now, you will ask what I mean by practice active reading is that you read it loud to your own self. Why? Once you're reading it to your own self, you'll be engaged into the whole patient's the case, and you'll focus that, okay, what is the main issue here? Why am I reading the patient's notes, or what am I doing with the patient's journal? So what is the main issue here? What are the key findings that I have to focus on? This will help you retain the important information. for your case in the next bay or in the next station. Number 6, time management. Remember, you are in this bay only for 9 minutes. How to keep record of the time, because there won't be a clock inside, and in order to, once you're managing the information, in order to keep the record, it's very crucial, it's very vital. What you can do, I would suggest, you can, for each section of the journal, like presenting complaint, past medical history, social history, family history, medications, etc., you can allocate 2 minutes for patients presenting complaint, for example, 2 minutes for patients past history, 2 minutes for patients examinations and findings, and so on. Once you'll do this, you'll be able to easily cover the important aspects of the patient within the 9 minutes time frame. Right. And my last and the most important advice would be stay calm and focused. Why? Because if you'll be calm and you'll be focused, you'll be able to manage and collect all the relevant information that you need to prepare yourself for the next examination station or for the next day, bay. Rather than, if you'll panic and if you'll get stressed, you'll most likely miss the important things or important information or important things, I would say. So with this, I would say thank you and all the best with your examination, and make sure to follow it. Bye.